EMDR therapy for complex trauma and PTSD. A comprehensive guide to healing, wholeness, resilience, empowerment, and growth. Written by Betiana Lauren Holmes. And narrated by Mary G. Chapter 1 Introduction. Complex Trauma and EMDR. Complex trauma and PTSD, post-traumatic stress disorder, both involve exposure to traumatic events, but they differ in important ways. While PTSD typically results from a single traumatic incident, like a car accident or assault, complex trauma stems from repeated and prolonged exposure to traumatic situations. This is most often interpersonal trauma experienced in childhood, such as ongoing abuse, neglect, or domestic violence, but can also occur in adulthood. The repeated nature of complex trauma has profound impacts on development and functioning. Children who experience chronic trauma often don't have a safe, nurturing environment to promote healthy physical, emotional, and neurological growth. They may face constant threats and stresses that keep their nervous systems in survival mode. Over time, this leads to pervasive difficulties that extend into adulthood. Some key characteristics of complex PTSD include severe emotional dysregulation, intense, hard-to-control emotions and reactivity, negative self-concept, chronic guilt, shame, feelings of worthlessness and defectiveness, relationship difficulties, trouble trusting others, fear of intimacy, re-victimization, dissociation, disconnecting from memories, emotions, or sense of self, somatization, chronic unexplained physical symptoms and pain, altered belief systems, loss of faith, hopelessness, despair about the future. In contrast, single-incident PTSD tends to have more fear-based symptoms like intrusive memories, nightmares, hypervigilance, and avoidance of trauma reminders. There is often a clear before and after in terms of functioning. With complex trauma, the symptoms are more pervasive, often starting in childhood and becoming interwoven with identity and relationships. Survivors may not have a clear sense of who they are apart from trauma. Judith Herman, a pioneer in trauma research, proposed that complex PTSD merits a distinct diagnosis due to these significant differences. While not an official diagnosis in the DSM-5, complex trauma is increasingly recognized as requiring specialized treatment approaches. Example: Maria grew up with a physically and emotionally abusive father who flew into rages and beat her and her siblings.
Sample complete. Ready to continue?